next. In Wellness Wednesday, it is the second most common form of cancer in men, and not knowing the facts actually can kill you. We will have what you need to know right after the break. Thanks, guys. Now, September is National Prostate Cancer Month and dedicated to raising awareness about the second leading cause of cancer death for men, killing 29,000 every year. The good news is that with early diagnosis, the survival rate is nearly 100%. I'm talking 100%. Still, many men won't get screened no matter what. Take a look.
Hey.
Okay, Dax. Prostate cancer exam time.
Not happening.
Dax.
Listen, I'd rather do anything than get a prostate exam.
I'd rather sit in the middle seat on a long haul. I'd rather sort my nephew's Legos by color. I'd rather watch 50 Shades of Grey with my mom. I'd rather fold a fitted sheet.
Where's the corner?
Oh, here we go.
Dax. A prostate cancer screening starts with a simple blood test, which we are already doing today.
Smart.
I mean, we have to laugh because it makes you laugh and engage. That was Dax Shepard. Dr. Robert Princenthal is an expert on prostate screening. He's a radiologist from RadNet, and now a lot even people, this is a taboo subject, talking about, men's private body parts, just like women's. Let's start. What is the prostate? Why is it so taboo?
The prostate is a small gland that sits between the rectum, the bladder, and the base of the penis, and it helps produce seminal vesicle fluid.
And why is there such apprehension among men to go into the doctor and get their prostate checks?
Good question. I think a lot of people, when they sit around their Thanksgiving table, they have an Uncle Harry who had his prostate out 20 years ago, and he has what we call I squared, impotence and incontinence. And most men are very uncomfortable should they get that as a side effect from being treated for prostate cancer.
Can you get that from as a side effect? Is there like a slim 1% chance? Is that the main reason?
That's the old way, but now with new treatment with robotic surgery, the incidence of that has gone down. But still, men don't want to have that done.
Well, we're talking about it. We're talking about penises. We're going to get into the heart of it. You talk about detection.
Yes.
Early detection is key in, combating, prostate cancer. Let's talk about some detection methods.
Men need to take a page from women because prostate cancer and breast cancer are two sides of the same coin. The exact same number of men and women are diagnosed each year of their diseases, and the same number die, but men are reluctant to get screened. So we need to encourage men to talk to their doctors about getting a PSA blood test.
So at what age should men get screened? Let's start with that.
The guidelines are controversial. It's between 55 and 75. We feel that the benefit of screening is even with the younger men. So if you have risk factors, try to get started at 50.
50. Okay, so what do? You go to your doctor and say, hey, I want to get my prostate checked?
Yes.
But with a blood test?
Yes.
Okay.
But the government makes people get shared decision-making conversations with their primary care doctors, which takes too much time. We really need to have men get the PSA, and the challenge is many men with a high PSA don't have cancer. So the standard of treatment was if the PSA was high or going higher, the urologist would stick 12 needles blindly through the rectum into the tiny prostate gland, hoping to find cancer by chance, what we call poke and hope.
Okay, well, poke and hope doesn't sound fun to me, but there's an alternative to poke and hope. It's called MRI. You can get an MRI. If you get the PSA blood test level, next you can get an MRI.
Yes, the MRI is a safe, non-invasive study that's much more accurate. So number one, we can exclude prostate cancer with a very high certainty to help men avoid having a benign, unnecessary biopsy. And more importantly, if we see a tumor suspicious nodule, the urologist can direct the needle and get higher yields and more accurate staging.
Okay, so here's the deal. Bottom line. Men out there, if you have a husband, brother, uncle, even a friend, tell them to go get tested and screened. Don't be afraid.
It's PCAM month, Prostate Cancer Awareness Month. Go get it done.
Go get it. I'm wearing blue, and we have our blue ribbons on for that. So for more information about prostate cancer and some great links on this, go to foxla.com. Get tested, get screened. You know what? Preventable medicine. That's what we're talking about.
You bet. Thanks for getting the word out.
You're welcome. Thanks so much. We'll be right back. 8:52. Stick around.